Thank you. I have feelings that I have been here before. And if I'm not mistaken, then I fell first time. It's my second time. I hope I will not fall again with my presentation. So, thank you for introduction. Oh. The agenda is, firstly I talk about background, what we actually did in telementoring pilot. Then, secondly, about objective. Then, step by step, the tasks we had to face it. Then, deeper into the pilot level, and then summary. So, what telementoring is, why we did it, and where we did it. This would be the question I try to answer with this slide. Telementoring, probably you well know that is virtual mentoring, and it is used very much already by everybody. So, but in this pilot, we looked more into the medical education as a medical education program for better opportunities for continuous medical education, professional development for healthcare workers. Therefore, it is very suitable for counteracting the professional isolation. For example, for doctor who is working in the hospital, it's for young doctor, for mentee, it's very easy to ask from the colleague for next door, or she or he could have easily build up the network, but instead patient who, not patient, young doctor who is working at a rural area doesn't have this network, and it's very hard to connect, reach out to the colleague. So that's why the telementoring tools could help this problem to be solved. Our pilot run in Finland, Lithuania, and Estonia. All those three countries had experience before. And Belarus was first republic who did not have much or none before experience in telementoring. So, objective, we have had lectures already before about comprehensive e-learning solutions, and on the paper it's quite simple. You have to have some kind of need. I show you. Need for people, then you have to have services and technology. Well, it's very simple, yes? But actually it's not, because technology is new to all of us. We're still learning. Every year it's changing. Services have to transform in a way. The seminar which we have here will be moved to web, there will be echoes, there will be technical issues which has to be solved. And of course, people's mind also is, they have to learn, educate themselves for new technology and for services. So on the paper, it seems it's working very well. We have a database where we put info in and people will take info out, but reality, it will start to work when there will be some kind of, we had a word, infrastructure. People want to own the info, what is in there. The stakeholders has to be people themselves. They want to get the information out. And in our pilots, people who wanted the info were general practitioners. Or healthcare workers. So we did simply. I owe very much thank for pilot project leaders who took very much responsibility to run the pilot, to develop courses, to put things into the web. So, and then we had the objective to gets a result and develop recommendation. The development of recommendation is still ongoing. So how we did it? We defined, actually Professor Toby has already talked, the tasks are very similar. We defined the main principles, made country-specific analysis, then we described state of art at the local level, exchange experienced in technical and content solutions. I think this was very important, this exchange part between different pilots, because different countries had a different experience and different cultural backgrounds. How to do telementoring. For example, Swedes and Finns have a more experience in telementoring or mentoring in general than in East, in Baltic and Belarus. We not very much used to of asking. In Professor Ross mentions that doctor has to be champion in Estonia. That's very much true. So they very rarely ask advice. They want to do it themselves. But this is another subject. We assessed the processes, and then we set up pilots and completed the evaluation of the results. And now we are in a process of publishing guidelines. Now, next I will go more deeper into the piloting, and here you can see on this slide, you can see who were involved in piloting. Finnish had the most strongest presence in piloting. They had 2 pilots, 3 and 4. South Estonia Healthcare District, Seinäjoki University, Kauhava Prime Care District. And they were well organized and well equipped. It was like my opinion about it. So Flensburg helped us out with literature review. It gave literature background and something to work and how to develop the practical guidelines for us. Estonian Family Doctors Association was lead partner and pilot 2. Vilnius University Hospital pilot 5, and Lithuanian University of Health Sciences took responsibility for evaluating all pilots, which was again very big help for us. And Belarusian pilot 1, actually 2 partners, State Education Institution, Belarusian Medical Academy of Postgraduate, and Ostrovets Central Hospital. I think they were pilots that actually started from zero, but did very much. So very impressive. And I will start from Belarus. So to give overview of this pilot, I first introduce the content. So telementoring pilot was carried out in cooperation between Belmapo and Ostrovets Central Hospital, and there had, in this figure down here, you can see the Belmapo as like an umbrella organization for all the central hospitals, and here you can see the information flow to the outpatient clinics. So 70 specialists and 8 GPs were involved, and distance between Minsk and closest outpatient hospital was at least 140 kilometers, so quite far away, and benefit from telementoring could be huge. They don't have to travel. Technology. Very simple hardware was conferencing system with laptops, web cameras, and wired connection to the internet. Wi-Fi, internet connection, 3G connection, different kind of connection were tested. And from software side, I would bring up the Moodle, which was main environmental software, web-based software. And for dialogue, they used OVO, which is very similar to Skype, or actually it's quite close to Skype. And they are both free softwares. And maintenance for those software and hardware was organized by Belmapo, all courses also. And telementoring services here done in the table form. You can see that through the overall telementoring dialogue there was 9 connections, video sessions 8, and I just want to show you which this overall connection looks like. Here you can see the communication. It's very much like a Skype. So they discussed different medical issues. Here you can see the video session between Belmapo and Ostrovets, and here down below you can see the Moodle course, which they had 96 together. Conclusion: essential was that the support came up to down. Ministry of Health of the Republic of Belarus supported training and qualification improvements, and it thus improves professional level of the primary health care specialist in remote areas. And they also brought up that cooperation experience gained with other partners was very, very important. Am I okay with the time? So Estonian is for me much easier to speak about because I was leader together with Eret this project. So the pilot was carried out between Estonian Society of Family Doctors and University of Tartu. The distances between Tartu and the GP centers were 40 to 190 kilometers. And there was 8 doctors involved, 4 mentors and 4 mentees. And here on the map you can see how much should mentee or mentor travel to the main center to get this education. Software we actually used quite different software platforms to test forum, e-learning, Skype for dialogue, and we have our own programmed web seminar platform. So we had 4 different software platforms to test. And hardware, we had the laptops, cameras, microphone, conference system. So actually pretty much very simple, nothing very special. And technology development and maintenance was done by Estonian Family Doctors Association. So services which were through the Skype, we had 2 sessions, and here you can, on the picture you can see when Eret connecting with other mentors. Here you can see mentors and mentees through the Skype. It does work well, but there is some limitation with you have to have very good connections, and sometimes can be echo and other issues. So just as a comment. We had a lot of video presentation courses, 41. Here you can see the example when doctor is here and the slides here. It's very useful when you're doing the course. Then afterwards you have to answer the questions, and with if you answer correctly you get credit points. So in Estonian Family Doctors Association you have to get 300 points in 5 years. We tested also forum. We had 15 patient cases, but we had the feeling that mentor and mentee had to be very motivated to go into forum and to answer the questions. So in a real world situation it might not work so well. And finally Moodle, which we had 2 months during the 2 months and 4 sessions. It is an extensive course with very extensive topics. Okay, here in this picture you can see how sometimes I do the video courses. I just film the doctor who has a presentation in front of it. So it's nothing really difficult. Anyone can do it. So I think this is one message to take home. You can do it and share it. Well, conclusion, yeah. I felt that management support all the time along was very good. So without this, it's impossible to do this kind of pilot or project. And when you have an existing network of mentees and mentors, it's good help as well. And it's when you learn new things, when you don't have a room or time constraints, it's a huge benefit. But contrary, when you don't have with people social connection, it can be boundary as well. And nowadays, like with the Skype, there, echo can be problem. So maybe 1 or 2 years to develop technology still needed. So okay, this I said. So it can save time and finances. Pilot 3. Pilot 3 was run in Finland and between healthcare units and professional in Kauhava Prime Healthcare District with 13 people, 1 mentor and 12 charge nurses. Distance between healthcare units were quite small, 15 to 50 kilometers, and whole cycle 160. Here you can see the cycle. Finnish Pilot 3 had a Polycom conference unit and Samsung monitors, so it's like all-in-one unit with the software. This pilot also tested connections between laptop and iPad with Cisco program. All the maintenance was done by private third-party provider. Here you can see the picture how it was done. This is an all-included teleconference system, and it was quite popular. Every 2 weeks, doctor or management get together to have a dialogue between each other. Here, one management, here another management, management of doctors, and you can learn a lot. Conclusions. So the conclusion was that actually this method is not only suitable for healthcare, e-health, but also in management, also for staff meetings. It helps to form network of mentors and mentees, saves time and cost remarkably. Lack of own motivation and management support could be threat, creates continuous cost, which can be limitation. Pilot 4 actually is quite similar, so only difference is, because I'm running out of the time, I'm trying to be quicker, is that software environment was Moodle environment, web-based, and to support this all-in-one Polycom video conferencing system. So they had this Moodle environment where they had 4 sessions and supported by Polycom conference system. I think it's very good solution, but it can be expensive for some of us. Conclusion, common agreement, it provides new opportunities for professionals, it saves time, and technical problems. For example, they had a technical problem on 3rd session. It gave negative feedback for others. 5th pilot is my last pilot, so I will be quick. 37 family doctors were enrolled, but only 14 actually took actively part. You can see the difference between Mentor Center, Vilnius University, and other centers. Software was Moodle free open software environment in web page and hardware, computer and network access. And the maintenance was done by Vilnius University. Here you can see how mentor is uploading the video or session, and mentees can look it whenever they want. They had impressive number of sessions, 128, and 20 themes. So what they concluded from this distant education is a form in form of film and video lecture, and presentation was well accepted by study participants, and technical conditions that had to be okay were quite simple. And it does need regular maintenance, and it saves time and finance for traveling. So, to summarize up, the 5 pilots were run at 2013 and worked together in close cooperation and learned from each other a lot. Telementoring is a very good tool to develop professional experience from younger medical specialists. It could be also one of the factors reducing potential professional isolation and through this brain drain while working in remote area. Financial perspective has to be studied further, because it seems there is quite a big benefit from it, time and travel saving versus higher maintenance cost in technology. So thank you for attention.